I'm interviewing today a colleague who I met a couple of weeks ago through my partner. Mr. Attar is an orthopedic surgeon. He's specialising in joint replacement and sports surgery and regenerative techniques. And I thought it'd be really fascinating to get some connected information from the rehabilitation side, from my point of view, and also from the opportunities presented by the regenerative techniques, PRP, potentially stem cells, we'll get into that as well today. Things that I can't normally touch on in the clinic because they're not my areas of expertise. So this should be fascinating. I'd like to introduce Mr. Attar, and would you like to introduce yourself to the audience?
Yeah, thanks. Good afternoon, everyone. Thanks for having me on board. I'm, as I'd explained, an orthopedic surgeon specializing in joint replacement surgery. Do a lot of sports surgery with arthroscopic work, and more recently, a lot of regenerative therapy and regenerative medicine approaches in managing osteoarthritis, sports injuries.
That's fascinating. So we obviously come at this from a slightly different angle independently, but I'm really fascinated by the opportunities to combine the two sets of techniques within my world, the electrostimulations and the electroacupuncture in particular, because of its very low invasive nature, but potentially from your side, the PRP and the stem cells potentially combined with that. Do you see any opportunities in from your point of view? What's your mindset at the moment in terms of how your patients can go that one step further that nobody else is talking about?
Sure. I think regenerative medicine, as well, just to give a little bit of a brief overview, if you like, to your audience, is a new modality of treatment that's been up and about in the last sort of 7 to 10 years, and it's been progressively gaining momentum over the years. And the areas in where it's used and the clinical indications are expanding. And over the last few years, we're starting to use more and more of regenerative therapy, such as PRP therapy, fat cell therapy, in treating and managing routine conditions, which otherwise would have required more invasive techniques, such as surgery. So that's the first point. Now, the second point is, the good thing about regenerative therapy is it is a therapy modality which is very easy to access, easy to do, and once it's done, most people can try and get back to their routine level of activities, routine lifestyle, which they've obviously, had a hindrance from because of pain, because of stiffness in their joints, or muscle injuries or tendon injuries, for example. So most of the outcomes we're getting are very good. Now, to go hand in hand with that, coming back to your point, is actually using an integrated approach with regards to getting people not just having the physical therapy treatment from the regenerative side, but also adding on physical therapy, any other modalities of treatment, such as shockwave therapy, electrostimulation, yoga, stretching exercises. So as long as we can try and get an integrated approach where we try and get all the modalities that are going to be suitable for that patient on board, and get started with that. That'll be the ultimate aim, really, to try and get the best you can for the patient using all the modalities we have available.
Yeah, and I think that's a really good summary of how we can use non-invasive techniques to become something synergistic, much greater than the sum of its original parts. And this will help people to find their way through, because no injury is the same between two people. So I find that some people do really well on these techniques, but they're just missing something else that perhaps they could do with something a bit deeper than I can offer, which is perhaps the PRP and potentially even the fat cell therapy. And from your perspective as well, I would sure there would be a gradation of people who would do really well with the PRP plus an improvement to the blood flow to the joint as well for maybe an extended period of maybe 3 to 4 months afterwards with ongoing care, without ruining all your good work with the PRP by using really deep massage techniques. That would, for me, be the perfect opportunity for the electroacupuncture, which is something that I know I compressed the base of my back, L3 to S1, when I was 22, and none of this was advertised to me at all. So I came into this through being fixed through alternative techniques. So I was given the opportunity of a cage around the base of my back, and I chose not to go through with that. and it's probably, I think, a very wise decision. Um, I'm fascinated here by getting this information out to people. What is it that you get asked repeatedly in your surgery that maybe we can answer now together and get that information out to people that would really help them?
Yeah. I think that's a very good point, actually, because most of the people who come to me for a consultation have been offered surgery elsewhere, and they're trying to look and find other avenues of treatment which they think may work just to get rid of their pain, buy them a few years, or buy them a little bit more time. And obviously, everyone wants to be pain free. Everybody wants to get on to do their activities that they like doing, they enjoy doing. And obviously, no one wants to go through an unnecessary surgical procedure if there are alternatives. And that's where regenerative therapy comes in on its own, really, because there are quite a few conditions where we can use and apply regenerative therapy techniques and different modalities of the regenerative therapy that we use, such as PRP, as we mentioned earlier, on fat cells, as concentrated PRP. So there's various different areas that we can explore that may be suitable for people to actually get them pain free, get them back to the level of activities, and avoid surgical procedures. So, most of the people and inquiries I get are based along those lines, where people think, well, I've been told I've got surgery, I'm really struggling, I've got a really bad quality of life, I just want to get back, just to kick a ball with my grandson in the park. Is there anything that you can do to help me? And that's normally the starting point. And obviously, with all of them, we say, for sure, we can have a consultation, we'll have a chat through, we'll see what investigations you had done, and then assess the suitability. I mean, not everyone will be suitable for it because, as we had explained, if people have got very severe arthritis or severe degeneration, they may not be suitable. But from that cohort of inquiries that we get, we get at least 40-50% of people who would be suitable for an alternative therapy medicine. And obviously, going hand in hand with that, we obviously try and find out all other modalities of treatment they've tried or they needed. And we try and see if we can try and integrate the management, not just with an injection, but with a good physical therapy program, muscle strengthening, if that's what they're lacking. Almost use a patient sort of specific approach to find out what the problem is. And it's not just A or B we're going to use to treat you, but we can supplement it with C, D, and maybe an E option later on would be more beneficial. So it's almost like a full comprehensive integrated therapy package approach that we're going after. So patients can come out at the end of their 4-month, 6-month treatment cycle to say, you know what, I can actually do what I wanted to do and I've not had surgery for it. And I think that's what our aim really should be.
Yeah, and this is what I get asked repeatedly for in terms of the longevity of the benefits of whatever it is that people have done. In terms of if they integrate this into their life. So yoga, for example, I get loads of people to go to my partner Helen for yoga because I know that I benefited from that. And I'm one of these guys, I was training for a 4-minute mile, I'm jumping up and down in the gym, probably far too much according to the textbook, but that is me, but the yoga is a balance to that. And for me, it's a real it's a real discovery that I would never have made without meeting Helen, from in my perspective,
Yeah.
and being introduced to it. So I think this is the power of the network here,
Yeah.
and that's something that I think people desperately cry out for because they don't have that connection.
I think it's just getting the message across to people as well, just to say that, this is available. And, we're sort of, at the moment, building up towards an integrated comprehensive service. And we're not just going after the straightforward option of surgery or straightforward option of just physiotherapy or straightforward option of just injection, because each patient is different and their pathology and injury is different, their outlook is different, their activity levels is different. So if we can tailor an approach which is going to be more specific for that person, they're going to come out at the end of it, a lot better. And our results and outcomes are going to be a lot better. And we're going to set out and achieve what they want to achieve, really, at the end of it.
Absolutely. And I don't know many people, if at all, maybe one person professionally who is doing this. This is unheard of. For people who come to see me, they have been to everybody. independently. This is the only reason I'm in practice, because they fall through the gaps and they end up at my door, and then I can help them to a certain degree, but then still missing perhaps some of these jigsaws. To bring this together could be the biggest revolution in rehabilitation that I can think of in my career. And I think it's that integration which is really the answer to all this. Whether you go and you see Mr. Attar and he advises the PRP, you have that done. Then it's a matter of getting some improved blood flow into that with some integrated massage potentially within a reasonable time, but the electrostimulations as well, right around to the joint capsule where we can get to. And then also following on from that, a graduated step of strengthening through the yoga. And this is what people are not receiving. They're getting pain relief, they're getting very, very basic physio offered to them, and none of this is jointed together. And I think if we then add on the dietary advice and the emotional therapy potential as well to get people back on the feet, this becomes a massively powerful tool. I'm often asked questions that I can't answer directly about stem cell, and it's a massive area. Would you like to give people a bit of information about this really popular, but perhaps not well understood area of ongoing medicine?
Yeah, absolutely. I mean, stem cell therapy, and we like to sort of classify it as fat cell therapy, really, because it encompasses a lot of other healing factors rather than just the mesenchymal stem cells that we're after. Now, this is an area, again, of more specialist interest, which has been used over the last 4 or 5 years. And in the musculoskeletal system for sports injuries, osteoarthritis management, we have enough cases now, enough data going back about 2 or 3 years to tell us that it's actually working. It's working well for the right patients. And again, it's a very straightforward procedure where we use people's own fat. We process it and we get all the healing factors concentrated and injected back into the joint or into the area of damage or concern. And it's a routine, straightforward procedure. It's done usually under a mild anesthetic or a sedation. It's a day case procedure. So they come in the morning, have it done, they're home by the afternoon. There's no restrictions to their activities. They can continue with their usual activities. They can continue driving. All we say is avoid any strenuous activities for a few weeks. And after that, the whole process really kicks in about 4 to 6 weeks before they start seeing and feeling the benefit of pain relief, improved function, improved inflammation. And those effects can be quite long lasting, as we've seen with most published data. So we've had people who've had the fat cell injection therapy done for osteoarthritis, for example, and have been 2 years, 2.5 years, they've been comfortable, been pain-free, they don't need any repeat injections, they've gone back to the level of quality of life that they were used to, with the activities that we're used to. And it's again, it's a very new, innovative, evidence-based approach in trying to manage a condition without surgery.
Yes.
Because it's a very minimally invasive procedure. And again, this adds a little bit more of an treatment option in our repertoire with regards to PRP, with concentrated PRP injections and fat cell. And obviously, as we had said earlier, if we can use a tailored approach to the patients, some patients may be more suitable for having the fat cell injections. Some people may be more suitable for having the PRP injections. And again, we need to have all those options open. And again, patients need to realize that this revolution of regenerative medicine is here and is here to stay. And accessibility of this is the key. So if they can try and access these services to their benefit and their potential, they'll gain a lot out of it.
Yeah, and this is exactly right. I've got a lady who is, I'm going to say approximately 88, and she was told that her hip condition was degenerating very, very quickly indeed, without there being much possibility. Now, she's quite open-minded, and she chose, despite the advice, to go through with the course of PRP injections, and with also a bit of intervention within 3 to 4 weeks with electrostimulation and massage a couple of months later. She's walking, she's not playing tennis yet, but she is absolutely as fit and as able as any 88-year-old I know. And mentally, it's really transformed as well, because she was in quite a dark place. You're already combining the stem cell fat therapies and the PRP. And I think that if we can potentially integrate further onto that, I think we could end up with a really groundbreaking approach is unique. Have I missed anything? Is there anything else you'd like to add on to this to broadcast out to people that they don't normally have access to the information?
I don't think so. I think we've covered most areas. I think the key message, really, what people need to understand is there are options available for them, and they don't necessarily just need to have surgery. There's other options that we can explore. Most people would be suitable for them. So don't suffer in silence. You know, if you've been told the only option you have is surgery, there's nothing else you can do, and you're struggling with pain, stiffness, don't suffer with that. Try and explore other avenues, explore other areas that can be beneficial for you. And regenerative therapy definitely is one modality which can. But like I said, don't just stay with just one treatment modality, because we're really trying our best to have an integrated approach with the physical therapy, yoga therapy, any additional adjuvants we can add in, dietary advice, and all this, like you had mentioned earlier on, I like that word jigsaw, because it all sort of fits in place. And once we get a patient who we're tailoring an approach or a management plan to fit in place, and that's the key. So that'll be key for them with regards to having a better outcome, better results, and it'll be key for us to make sure our treatment and therapies and modality are working for that patient. So the key message really to get out there is don't suffer in silence. There's other options available. Explore, and obviously, you know, we will hopefully have something there for you.
Yeah, and this is it. I wish I was told this years ago, and it would have, for me, it would have transformed me mentally as well when I was at my darkest with the injury. And I think having these people, we've got this wonderful platform able to broadcast. How do people contact you directly? And would you like to give out your contact details and how people would be able to ask you more questions?
Absolutely. I mean, we've got secretary accessible pretty much 9 to 5 throughout the week, and that's the easiest point of contact. We've also got an email hotline, which they can contact us through. And once we get the patients through, we contact them, we find out a little bit more details about them. And obviously, if they've come from any other referral service, we try and find out any other information of the treatments they've already had done, any procedures they've had done, currently what treatment they're having. So it gives us a little bit of a synopsis with regards to where they are on their journey of recovery. And then what we can do is get an e-consultation organized for them.
Oh, really?
To get a bit more information,
Wow.
and then we can then take it from there. So the first step really be is either contact us via my secretary or an email hotline, and then we can take the process further from there.
Fantastic. Well, if it's okay, I'll put the details under the video, and then people can have a direct
Absolutely.
hook through
That's
to you on that
fine.
basis. And who knows, that there will be countless people out there crying out for information. This is just one brick in their story. I think that hopefully we can pass that on to them, and they can go and put it in place. It's been really
Absolutely.
fascinating. I'd love to do another one, maybe a follow up after we've done a few case studies, so we can actually report back to people.
So that'll be great. Yeah.
And potentially, if you need any more information about the traditional medicine approach that I can help you with, I'd be more than happy to.
Absolutely. Perfect.